Welcome to the deep dive, where we take these massive topics and, break them down for you. And today, we're talking about cosmetic procedures, which are usually all about control, right?
Oh, absolutely. Total control.
Yeah, like you sit in this quiet, sterile clinic, and a tiny needle places this highly engineered filler exactly where it belongs, and it just stays there. You get this predictable, mathematically precise result.
Right. It's very clinical.
But then, what happens when that pristine, highly controlled cosmetic environment just gets hit by, the unstoppable, completely chaotic biological force of childbirth?
It's such a wild collision, honestly. We are looking at this fascinating intersection between modern aesthetic science and ancient human biology.
Yep.
And as women increasingly seek out solutions for intimate wellness and, functional body confidence, the medical landscape is being forced to map this out. Like, how does a cosmetic procedure done on a Tuesday interact with the delivery room a year later?
Exactly. And you really cannot make informed choices about your body if you don't understand that physiological chain reaction. So today, we are taking this massive stack of medical clinic websites, OBGYN blogs, and plastic surgery resources. And we're synthesizing them for you to answer one highly specific, incredibly fascinating core question.
Right.
Does receiving labial filler impact your future ability to have a natural childbirth?
And understanding the mechanics of these treatments allows you to really navigate the noise. I mean, there's a lot of fear and misinformation out there regarding reproductive capabilities and cosmetic alterations.
Oh, tons of it.
Right. So looking purely at the anatomical facts is really the only way to separate the myths from the medical reality.
Okay, so let's unpack this. Before we can even visualize how a pocket of cosmetic filler interacts with a baby passing through the birth canal, we need to understand the underlying architecture, right?
We definitely do.
We need to know exactly what is being injected and where. The clinical sources refer to this primarily as labia majora augmentation, though, you might see it marketed colloquially as labia puffing.
Right, labia puffing. So the labia majora are the outer hair-bearing lips of the vulva. And to augment them, medical professionals generally use one of two methods.
Okay.
The first is injecting hyaluronic acid dermal fillers, or HA fillers. And these are functionally very similar to the gels used to, plump lips or contour cheeks on your face.
Oh, gotcha, like the stuff people get in their facial wrinkles.
Exactly the same concept.
Yeah.
And then the alternative is an autologous fat transfer, which is a surgical procedure where a doctor uses liposuction to harvest fat cells from your own abdomen or thighs.
Right.
They purify those cells in a centrifuge and then strategically inject them right into that outer labial tissue.
And looking at the data in these sources, it is so easy for society to dismiss this as purely vanity. But the research points to a massive functional component, doesn't it?
Oh, completely. It's not just cosmetic at all. Around 40% of women notice significant, really uncomfortable changes in their intimate areas due to aging or hormonal drops.
Leading into menopause, right?
Yes, exactly. Or even from significant weight loss. We are talking about severe volume loss. The loss of estrogen and natural collagen causes the labia majora to literally deflate.
Deflate. Wow.
Yeah. And when that thick adipose tissue thins out and loses its structural integrity, it starts performing its primary biological function.
Which is protection, right?
Right. Biologically, the labia majora evolved to act as a heavy protective cushion for the much more delicate, sensitive internal anatomy of the vulva and the vaginal opening.
Right. And without that cushion, the clinical blogs detail this condition that is sometimes called sports vagina.
Yeah, that's a term you see a lot.
Which sounds intense. Women experience brutal, painful friction and chafing during everyday activities. We are talking about cycling, horseback riding, high-impact workouts, wearing tight clothing, or sexual intercourse.
It's incredibly painful. The delicate internal tissues are suddenly taking the brunt of mechanical friction they were literally never designed to handle.
So they get the filler to fix that.
Exactly. Women are seeking out labial fillers to restore that barrier. They are asking doctors to basically rebuild a protective shock absorber.
Yeah.
So it is a functional restoration just as much as a cosmetic enhancement. It treats chronic discomfort that can severely limit a woman's active lifestyle.
The mechanics of it remind me of a slightly deflated bicycle tire.
Oh, that's a good way to look at it.
Like you aren't changing the fundamental structure of the wheel, right? You aren't replacing the metal spokes or the rim. You are literally just restoring the cushion of air inside the tire so that the hard metal rim doesn't grind against the pavement and give you a bumpy, painful ride.
Right.
You're just putting the padding back exactly where it originally was.
Yes. Expanding on that bicycle tire concept, the filler is purely a surface-level intervention. You are restoring a superficial layer of protection without altering the deep, fundamental mechanics of the pelvic structure itself.
Which brings us to the core mystery you were probably trying to piece together right now as you listen to this. We have this outer tissue plumped up with gel or transferred fat. What happens when that exact tissue is subjected to the intense, unprecedented biological stretching of a natural childbirth?
That's the big question.
Because I'm having a hard time wrapping my head around the physics here. If childbirth stretches the birth canal to its absolute biological limit, how does a pocket of injected gel or fat not just, rupture, migrate, or get pushed completely out of place by the sheer mechanical force of a baby's head?
I mean, it sounds like it would be a disaster, right? But the medical consensus across all the obstetric and plastic surgery literature provides a definitive, really clear answer.
Okay, lay it on us.
Receiving labial filler does not negatively impact future natural childbirth.
Wow, not at all.
Not at all. There's absolutely no medical conflict between having had your labia majora augmented and giving birth vaginally. The filler does not block the baby, and the baby's passage does not cause the filler to violently burst.
But how is that anatomically possible? I mean, during a vaginal delivery, the hydrostatic pressure and the stretching in that entire pelvic region are extreme.
Yeah.
Doesn't artificially inflating the tissue make it more fragile? Or, more prone to catastrophic tearing during labor?
What's fascinating here is how the female pelvic anatomy is layered, and really how compartmentalized the different tissues actually are.
Okay.
The biocompatible dermal filler, or the transferred fat, is injected exclusively into the superficial subcutaneous fat layers of the labia majora. It basically sits directly under the outer skin.
So it's right on the surface.
Exactly. It does not penetrate, interact with, or alter the deep vaginal muscular layers. It remains completely separate from the pelvic floor muscles.
Oh, I see. So if we look at the birth canal, like a heavy-duty muscular tunnel, the labial filler is essentially just the decorative wallpaper on the exterior facade of the building.
That is exactly what it is.
Right. So tearing down the inside of the tunnel or stretching the tunnel walls to their absolute maximum doesn't inherently mean you are structurally interacting with the wallpaper on the outside.
That structural separation is the absolute key to why the procedure is safe for future pregnancies. The deep internal muscular sling of the pelvic floor is doing all the heavy lifting.
Right.
Its elasticity and strength are what stretch to accommodate the baby. The superficial fat pad of the labia majora is simply pushed outward and out of the way.
Makes sense.
Furthermore, modern hyaluronic acid fillers are incredibly pliable. They are engineered to integrate seamlessly into the cellular matrix of your natural tissue. They do not harden into rigid roadblocks or pockets of solid mass.
They aren't just solid bumps.
No, they are flexible gels that move, compress, and stretch dynamically with the surrounding skin.
Okay, but what about the tearing aspect? Because I know one of the major concerns women have is obstetric trauma.
Right, and looking closely at the mechanics of obstetric trauma, we see that spontaneous vaginal tears during childbirth, or episiotomies,
which are the intentional surgical incisions made by a doctor to quickly widen the birth canal, right?
Exactly. Those primarily affect a very specific area called the perineum.
The perineum being that small, highly tensioned space located directly between the bottom of the vaginal opening and the anus.
Yes. And because the perineum takes the brunt of the downward mechanical force as the baby's head crowns, that is where the vast majority of tearing occurs. The tension is concentrated centrally. Tears and episiotomies do not typically extend upward and outward into the superficial outer labia majora, which is where the cosmetic filler actually resides.
That's completely separate.
Right. Because the filler is structurally isolated from the primary zone of trauma, it doesn't cause the tissue to tear any more than it naturally would under the sheer force of labor.
Okay, the anatomical layering makes total sense. We have firmly established that the filler will not ruin your childbirth, and it will not block the baby. But here's where it gets really interesting.
Oh, yeah.
Does childbirth ruin your filler?
Yes. The clinical data points to a massive reversal here. While the filler won't stop you from giving birth, The immense biological act of gestation and delivery will likely completely destroy, distort, or just erase the cosmetic work you paid for.
It's such a brutal irony. I
Yeah.
mean, you spend thousands of dollars, you go through the clinic visits, you get the volume meticulously restored, you have your perfectly padded bicycle tire. And then pregnancy comes along and systematically changes the entire landscape from the inside out.
It really does.
And looking through these sources, it is not just the dramatic event of the delivery itself that ruins the filler,
Yeah.
right? It is the slow, grueling, 9-month systemic takeover of the gestation period.
Exactly. Pregnancy forces the body into an extreme state of biological adaptation. During gestation, a woman's body experiences a massive systemic increase in blood volume. The literature actually notes an increase of up to 50% more blood circulating through the body to support the fetus.
50%. That is insane.
It is a massive shift, and this massive surge in pelvic blood flow is combined with a relentless flood of hormones, particularly estrogen, which peaks really heavily in the second and third trimesters.
And what happens when that specific hormone cocktail hits the vulva?
The tissue becomes heavily engorged, the labia naturally enlarge, they elongate and darken in color. The entire region is experiencing chronic, prolonged swelling.
Okay, and this is where understanding the chemical properties of the filler itself becomes super vital. Because hyaluronic acid isn't just a space-occupying gel, it is a humectant.
Right.
Its primary chemical trait is that it attracts and binds to water. Some estimates say HA can hold up to 1,000 times its weight in water.
Which creates this compounding biological reaction. If you place a water magnet into a biological environment that is currently flooding with excess blood, pregnancy-induced edema, and massive water retention.
It acts like a sponge in a flood.
Exactly. It acts like a sponge in a flood. It pulls in all that excess fluid, expanding far beyond its original, meticulously injected boundaries.
And then, the baby is finally born, the umbilical cord is cut, the hormones eventually crash, the blood volume slowly returns to normal, and the biological floodwaters recede. The sponge dries out.
Leaving behind a radically altered baseline.
Yeah.
After delivery, as the tissues shrink and resettle over the following months, women routinely experience a new, permanent loss of volume. The prolonged stretching from the pregnancy itself, combined with the acute trauma and extreme pressure of the delivery, can permanently damage the natural collagen and elastin networks that the filler was originally injected to support.
It is the biological equivalent of overinflating a balloon for 9 continuous months, stretching the rubber to its absolute limit and then suddenly letting the air out.
That's a sad but accurate way to picture it.
Right. The balloon is never going to snap back to look exactly the way it did before you blew it up. The elasticity has been compromised, the structure is stretched, and the material is worn out. You end up with new sagging, deep wrinkling, or highly noticeable asymmetry in the labia majora that simply wasn't there before the pregnancy.
The aesthetic outcome is almost always compromised. The physical trauma and stretching of the area essentially erase the clinical precision of the initial treatment. Patients will almost certainly need a complex revision or a completely new, more extensive treatment post-pregnancy to address the new, deflated baseline of their anatomy.
Which fully explains the incredibly strict guidance practically every single surgeon in these sources lays out. I mean, they strongly, unequivocally advise patients to wait until they are completely finished having children before investing a single dollar into labial augmentation.
Investing in this procedure when you know you want another child in a year or two is basically fighting a losing battle against biology. The cosmetic results just cannot survive the systemic tempest of a pregnancy.
That makes perfect financial and medical sense for someone planning the next 5 years of their life. But that brings up a highly specific, very urgent scenario found in the clinical FAQs.
Okay.
What about the women who are currently pregnant or who are struggling with postpartum body changes and want to go to the clinic immediately to fix the discomfort or the deflation? We really need to look at the strict medical timelines governing these procedures.
Yeah, and if we connect this to the bigger picture of aesthetic safety and medical ethics, the community is uncompromising here. The FDA, board-certified plastic surgeons, and OBGYNs universally enforce a blanket ban against getting dermal fillers of any kind, and that includes labial fillers while you are pregnant or actively breastfeeding.
And we should be crystal clear on the scope of that ban. The guidelines don't just restrict vaginal fillers. It covers lip filler, cheek contouring, Botox, literally everything. And the reasoning behind this ban is fascinating because it's not necessarily that the scientific community knows for a fact that the hyaluronic acid is highly toxic to the fetus.
Yeah.
It's actually the exact opposite problem.
Right. The restriction is born out of a massive ethical data gap. Medical science does not, and really cannot, run clinical trials on pregnant women to see if cosmetic injectables harm a developing fetus.
Right, obviously.
The ethical implications of potentially causing birth defects just to test a wrinkle filler are obviously catastrophic. We simply do not have the safety data. The scientific community does not decisively know if the cross-linking chemicals in certain fillers or the neurotoxins in Botox can cross the placental barrier or enter breast milk.
So without that data, the default medical stance just has to be absolute, unwavering caution.
Precisely.
But beyond the ethical unknowns regarding the baby's development, the sources point out that getting filler while pregnant is also a guaranteed recipe for a disastrous cosmetic result for the mother.
Yes, returning to the humectant properties of hyaluronic acid we discussed earlier, injecting a water-binding gel into tissue that is already artificially swollen, chemically altered, and heavily engorged by pregnancy hormones means the surgeon is essentially flying blind.
Wow, yeah.
The tissue architecture is temporarily distorted. If a doctor tries to contour a labia that is currently swollen with 50% more blood volume and extreme water retention, the results are going to be completely disproportionate, asymmetrical, or highly exaggerated once that pregnancy swelling finally subsides.
So the ban is strictly enforced. The woman goes through the remainder of her pregnancy, the baby is born, and the mother is recovering. But looking at the OBGYN guidelines in our stack, the postpartum recovery timelines are surprisingly long. I mean, a patient cannot just run back to the cosmetic clinic at week 6 when the doctor gives the standard all clear for normal exercise and intercourse.
No, not at all. The standard 6-week checkup is merely clearing the patient for basic functional living. It is not an indicator that the pelvic anatomy has returned to its permanent state.
Oh, I see.
For a woman looking to get hyaluronic acid labial filler, the medical consensus requires a minimum wait of 3 to 6 months after childbirth. And crucially, that timeline only begins after she has completely finished breastfeeding.
Wow. Why such a massive delay? I mean, if the filler is just superficial, like we said, why demand a 3 to 6 month wait?
Because the superficial tissue is directly impacted by the deep tissue recovery. The entire pelvic floor, the deep vaginal musculature, and any healing perineal tears require months to fully resolve internal inflammation and microscopic swelling.
Right.
More importantly, the endocrine system needs that 3 to 6 month window to allow the extreme fluctuations of pregnancy and lactation hormones to completely stabilize. The surgeon needs the body to settle into its absolute final, quote-unquote, new normal baseline anatomy.
That makes total sense.
Because injecting filler while residual invisible postpartum swelling is still present means the surgeon is aiming at a moving target, which inevitably leads to botched results down the line.
And if a woman decides to opt for the autologous fat transfer instead of the AJ filler, harvesting fat from her thighs or abdomen, the wait time jumps even higher. We're looking at a 6 to 12 month mandatory postpartum wait.
The fat transfer is a significantly more invasive proposition. It involves liposuction, which is a true surgical intervention requiring local or general anesthesia.
Yeah, that's real surgery.
It is. The human body requires drastically more time to recover from the systemic stress, blood loss, and cellular trauma of childbirth before it can safely withstand the physiological shock of another surgical procedure.
Plus, reading through the plastic surgery protocols, there is a major logistical issue regarding weight, right? Postpartum weight fluctuates wildly in the first year as the body sheds fluid and readjusts its metabolism.
Which is critical for a fat transfer. A surgeon needs your body weight to be completely stable for several months before they harvest and transfer living fat cells.
Oh, because if you lose weight after.
Exactly. If they perform the transfer while you are still actively losing 30 pounds of baby weight, the newly transferred fat cells in the labia will shrink proportionally as you lose weight, entirely defeating the purpose of the volume augmentation. And conversely, if you gain weight, those cells can expand unpredictably.
Wow. So what does this all mean? Let's distill the mechanics, the timelines, and the biology of this deep dive down for you. Labial fillers, whether hyaluronic acid or fat transfer, are a safe, structurally superficial way to restore vital volume and protective comfort to the outer vulva.
Yes.
If you are struggling with chronic chafing, physical pain during exercise, or severe functional discomfort due to volume loss, it is a highly effective, targeted medical option. And more importantly, we've definitively established that having this superficial filler fundamentally does not impede a woman's biological ability to have a safe, natural vaginal delivery.
Right, it really doesn't.
The filler sits harmlessly on the outer surface, while the intense, heavy lifting of labor happens deep within the separate muscular sling of the pelvic floor.
However, the immense physical, hormonal, and hydrostatic changes of pregnancy and childbirth will almost certainly stretch, distort, or completely destroy the carefully calibrated aesthetic results of that filler.
Which is the harsh reality.
It is. Which makes the timing of the procedure the single most crucial factor for success. The clinical mandate is clear: wait until your family is complete, and wait a strict minimum of 3 to 6 months after your last delivery and entirely after you finish breastfeeding to let your body settle into its new baseline.
And the overarching rule of thumb in all these sources: always consult with a board-certified plastic surgeon or a specialized urogynecologist. You need a medical professional who deeply understands the complex layers of pelvic anatomy, not just, an esthetician who knows how to operate a syringe.
And this raises an important question about how we approach our own biology. The goal of unpacking this clinical data is ultimate listener empowerment.
Absolutely.
Understanding the actual physical mechanics, the anatomy of the deep pelvic floor versus the superficial fat pads, the water-binding nature of hyaluronic acid, the biological flood of gestation. It all allows you to make grounded, highly informed choices about your body. You should never have to make medical decisions based on fear, societal stigma, or biological misinformation. When you understand the why behind the anatomy, it entirely removes the fear of the unknown from the equation.
It really grounds that pristine, highly controlled cosmetic clinic environment in the raw, undeniable reality of human biology. But I want to leave you with a final lingering question to ponder long after this deep dive ends.
Okay.
We started by examining the sharp contrast between the sterile perfection of modern cosmetic engineering and the chaotic, primal force of childbirth. As medical science rapidly evolves, giving us more and more accessible tools to instantly rejuvenate, plump, and perfectly alter our intimate biology to match a pre-pregnancy ideal, how does the rising popularity of these exact procedures shift our cultural expectations of the postpartum body?
That is a deep question.
Right. If we now possess the technology to seamlessly erase the physical signs of aging and the extreme biological stretching of childbirth with a 15-minute injection, are we slowly losing our societal acceptance of the natural physical evidence that a woman's body has achieved the incredible, monumental feat of bringing life into the world?
Wow.
Are we unknowingly demanding that women's bodies look as though they have never lived, never adapted, and never given birth? It is a complex tension between celebrating genuine medical empowerment and quietly fighting unrealistic aesthetic pressures. And that is absolutely something worth thinking about the next time you look in the mirror.